Yeah, I would like to bring the basic details of PRP. I just wanted to bring question and answers for the patients for easy understanding. That's what we are going to discuss today. What is PRP? There are a few questions we would like to discuss. Number one question is, what is PRP? PRP is nothing but platelet-rich plasma. A little in detail about PRP is, when we have platelets in our blood, these platelets has inside growth factors. So all put together we say growth factor complex we say. These when we take the blood and send for centrifugation, so platelets are subjected to trauma and we get the growth factor complex out of it. That solution combinedly called as platelet rich plasma or PRP. What is the difference between a PRP and bio-PRP? Most of the clinics they do their own techniques. Though techniques are different, the procedure almost same. As we already discussed about, PRP is kind of extracting the growth factor complex from the platelets. In this bio-PRP, we're going to add 52 types of micronutrients like vitamins, micronutrients, all this stuff we're going to add to that. When we add this all micronutrients, multivitamins, amino acids, that will be called as a bio-PRP. It has a little added advantage over the plain PRP. This is called bio-PRP. Tube looks like this, very clear. This contains amino acids, proteins, multivitamins. We're going to put 8 to 9 ml of venous blood into this and send for centrifugation. That part I'll show you. This is a PRP, this yellow color. This part we are going to inject into the scalp. This part will discard. This is called the platelet-rich plasma. Who's benefited with this PRP? So this is a very intriguing and interesting question. And usually this PRP is useful for cell multiplication and cell division. That can be skin or bone or even the hair also. So we are talking about hair fall treatment here today. So who's going to benefit with this PRP is youngsters who's going to lose hair, who's having a very beginning phase of hair fall or hair loss can be benefited. Females who has got thinning hair can be benefited, and whoever has got complete baldness, like now there is no hair at all in the scalp, but for them probably this PRP may not be useful. So whoever has the beginning phase of hair fall can be addressed, and miniaturization happening in some patients, like there is a balding process, for them also it will be useful, and it can be used adjuvant to the transplantation procedure. It may not be useful someone who is completely bald. That's what we should think. And usually 3 or 4 PRPs is more than enough to know the growth, and frequency is 1 month interval. So every month, first month, second month, third month, usually enough. Sometimes we need to give even 4 or 5, but I don't think you need 20-30 PRPs to know about the growth or whatever the progress. So 3-4 would be usually enough to understand the growth process. I don't think it's painful because we do give local anesthesia gel or cream or injections before the PRP. It hardly there is any pain. It's very much manageable to take the procedure. The procedure is very simple. Giving local anesthesia will affect the efficacy of the PRP or not? Actually no, because local anesthesia would not affect your PRP results or outcome. It does not change any efficacy of the PRP, because even local anesthesia in fact will help you to localize the PRP injection in the scalp. That is good for us. So there is no relation between local anesthesia and bad results of the PRP. It's not true. So you can take local anesthesia and take the PRP, no problem. What about results in PRP? Another interesting question. Results depends on each patient and varies to patient. Usually someone has hair fall that can be easily addressed with a PRP, and someone has stress related hair fall, even telogen and effluvium, even a balding process. For them definitely it is useful, but however each patient hair fall reason may be different, and it's very difficult to say who's going to benefit, who's not going to benefit by looking at the photos or in a general manner. It's always better to see a doctor. We can suggest whether it is worth taking PRP or not. That's a good way to go about your PRP. Usually it benefits a lot of the people, but we cannot say it varies to person until unless we examine the person's scalp. We cannot decide whether it is worth giving or not. What is the warranty and guarantee for this PRP treatments? My friends, this no medical service is warranted and guaranteed. We all know it's not a gadget to buy, it's a health. So no one never know what happens. So warranty guarantees are not applicable for any medical treatment, including PRP. So most of the things is most of the people get benefit. That's what we can say with over 10-15 years experience of giving PRP to many people. We can assume that we get a lot of benefits with the PRP, more than 70 to 80% of the people. However, it varies to the person. So kindly do not fall as a prey for this warranty guarantee advertisements. Do I continue minoxidil or other medications with PRP? And this is another question I come across. What I would like to say is there are a few patients will ask me, is it mandatory to take multivitamins, minoxidil? What I would say is we always try to get best outcome with all these multivitamins, PRP and even transplant. So we better not to skip these medicines provided by your doctor. It is an adjuvant to your medicines, that could be minoxidil and other multivitamins and even in transplant. So I recommend it is better to take provided frequency and duration medication which is provided by your doctor, and PRP is always better. So it always had an added advantage when compared to taking a straight PRP. Of course, it is left to patient choice again. And if you're already using more medicines and if you really want to avoid it, yes, you can still avoid the medicines and take the PRP injections too. And do's and don'ts I would like to discuss in a little detail. You have to have breakfast or lunch, whatever it is. Do not come on empty stomach. Another important point is do not take alcohol at least 12 to 15 hours prior to the PRP injection. After this PRP injection, you can get back to your work. You can drive a bike or car, or you can use helmet, you can shampoo, or you can get back to work, any work immediately. So there is no restrictions after that. And you can do hair wash also, no problem. There is no special instructions after the PRP injections as such. What are the side effects of the PRP? Another question. Usually there are no side effects because we're going to take your own venous blood and prepare PRP out of it, and it's a very safer procedure to take. One should not worry about any side effects. Our conclusion about PRP injections are it is worth taking because it definitely controls the further hair loss, and youngsters would really doesn't want to go with transplantation procedure. It's a better alternative choice, and most of the youngsters go for transplant age of 20 to 23. That's not a good practice. For them, definitely PRP is useful, and someone has healthy hair, they want to maintain a longevity of the hair, healthy hair for a longer time. This PRP is useful, and there are no side effects because we're going to take your own blood. That's another added point. So overall, it's worth using, provided by your doctor, and to maintain the health of the scalp and hair.